Okay, I think I've given permissions for everyone to record.
Oh, great.
They can text
Recording
me
in
if
progress.
not, if I missed somebody. All right, we're ready to go. Want me to start the countdown? Everybody ready? Head my mic up. All right, we are going live in 5, 4.
Hello, everyone. Thank you for joining us on this Friday morning. I'm Erica Harquist, Public Information Officer with the Oregon Health Authority. And today we are providing an update on the very latest developments in the COVID-19 pandemic here in Oregon. Joining us today are Dr. Dean Seidlinger, Health Officer and State Epidemiologist, and Dr. Don Nolt, OHSU Infectious Disease Specialist and a Professor of Pediatrics and Infectious Diseases at OHSU and OHSU Dornbecker Children's Hospital. This is a friendly reminder, as always, to please mute your audio and use the raise your hand function if you'd like to be added to the queue, and I'll add you and call on you to ask a question. Hopefully we've granted permission for those of you who have asked to record. That takes a one-by-one process, so thank you for your patience with that. If you haven't been granted permission, feel free to message us, but we believe we've granted everyone permission. This is an opportunity, as you know, per usual, for the media to ask our questions and hear from our experts. The public is always encouraged to ask their questions during the Facebook Live events that we host. So let's get things started. Dr. Seidlinger.
Thank you, Erica. Good morning. I'm Dr. Dean Seidlinger, Health Officer and State Epidemiologist at Oregon Health Authority. Thank you for joining us for this update on the state's continued response to COVID-19. Today, I'm joined by Dr. Don Nolt, Professor of Pediatrics and Infectious Diseases at the OHSU School of Medicine, who will provide an update on the anticipated arrival of COVID-19 vaccines for young children, possibly by this coming Monday. This month marks the third summer of living with COVID-19. Some Oregonians continue to feel the loss of family members and friends to this disease, and we acknowledge those losses, even as many of us get together to enjoy pleasant weather and renewed connections. As we get ready for summer activities, all of us can continue to take basic steps to protect ourselves and loved ones as we support others who might be recovering from COVID-19 illness or dealing with long-term symptoms. For many families, the start of summer this year began with cherished events they had to cancel or change the past 2 years, such as school graduations for all ages. We know the pandemic has been especially hard on families with children, schools, and educators who sacrificed tremendously. Thanks to our early childhood and K-12 school staff for their work in providing consistent access to in-person instruction and for keeping our schools and young people safe while helping our students succeed. I also want to thank my public health and healthcare colleagues for their continued tireless work to keep us safe and healthy as we continue to battle with COVID-19. Today, I will highlight our latest data. I will also discuss OHA's ongoing efforts to keep Oregonians informed and safe. This includes statewide access to safe and effective vaccines and boosters, as well as therapeutic treatments. Finally, I will outline the schedule for the expected authorization of vaccines for the youngest children, 6 months to 5 years, our last group to receive protection from COVID-19 vaccines. Since our last update, May 18th, COVID-19 cases appear to be leveling in our state. Test positivity rose slightly from 11.4% on May 16th to 11.7% on June 14th. During the last month, daily reported case counts also have leveled from a rolling 7-day average of 1,401 cases reported on May 16th to 1,487 reported on June 14th. We assume these numbers are a dramatic undercount of the actual number of cases because we know many people are using at-home tests and not reporting the results. We also know many others are not getting tested. Trends in this state and around the country tell us there are higher levels of transmission. With our community and university partners, OHA can monitor the spread of the virus through our wastewater surveillance system in more than 40 communities. Those systems also tell us we are seeing a high level of spread that is similar to what we detected during the Delta and Omicron surges. Data for the total number of Oregon's hospitalized patients with COVID-19 show they should not exceed our hospital system's ability to care for them. Since our May 18th update, hospitalizations have gradually climbed from 255 COVID-19 positive patients reported on May 16th to 290 reported on June 14th. Oregon Health and Science University's modeling team, headed by Dr. Peter Graven, forecasts that the number of COVID-19 positive patients in Oregon's hospitals likely have peaked at 327 on June 5th. This is less than 1/3 seen during the Delta and Omicron waves, when we had peaks of 1,178 on September 1st and 1,130 patients on January 27th, respectively. OHA continues to track COVID-19 hospitalizations and support our state's hospital system. We remain ready to respond to future surges. OHA also continues to track the prevalence of COVID-19 variants and their impacts on Oregonians and our health system. Our hospitalization numbers have shown a steady increase in numbers with BA2 Omicron as the dominant variant since March. Evidence still shows that current vaccines, combined with high levels of vaccination and recent previous infections with the virus, offer strong protection to prevent severe illness for most people. OHA and our partners continue our surveillance of new subvariants such as BA4 and BA5. Nationally and in the Pacific Northwest, they account for less than 20% of all tested samples. The good news is that far fewer people are getting seriously ill with COVID-19 now than during previous surges. However, trends tell us people are still getting sick. Just last week, on June 9th, the CDC released its weekly update on COVID-19 community levels, and 3 counties in Oregon moved into high transmission levels. While those 3 counties have moved back to medium this week, 3 additional counties are on the CDC's high community level transmission this week. These latest developments remind us that the pandemic hasn't ended. If you are connecting with others outside of where you live, you are at risk of exposure. This can be at work or school, at events with friends and family, or during summer travel. The tools widely available are keeping most of us safe. Being up to date with your vaccinations, including boosters, is the best way to prevent severe disease, including hospitalizations and even death. Vaccines are widely available in clinics, pharmacies, and at vaccine clinic sites. For people who are older and adults of all ages at high risk who do get COVID-19, a highly effective treatment is available in the form of a pill called Paxlovid. Information about Paxlovid and other treatments can be found on OHA's COVID-19 website. OHA strongly recommends that anyone who may be at increased risk because of age and underlying health conditions make a plan now about how and where they will get tested and receive treatment if they become ill. Those who don't have a healthcare provider may contact their local healthcare center or call 211. Finally, we can't forget about the benefits of masks. For those at high risk or for folks who care for or live with someone who is at high risk, wearing a mask in indoor public places offers extra protection. Wearing a mask in areas with higher transmission offers everyone extra protection. Before I wrap up and turn to Dr. Dawn Nolt for comments, I want to highlight a development that many Oregon families with young children have waited for that she will discuss in more detail. As of today, the U.S. Food and Drug Administration has recommended expanding emergency use authorization of the Pfizer BioNTech vaccine for children 6 months to 4 years, and the Moderna vaccine for children 6 months to 5 years. The CDC will complete its review this weekend, along with the Western States Scientific Safety Work Group. This is the last group of residents who have not been able to receive the protection provided by vaccines. It's a big group too. In Oregon, the population of children ages 6 months to 5 years is about 230,000. Both vaccines have been tested in clinical trials that involved thousands of children and continued for several months. Both proved to be safe in children. The rates of COVID-19 are lower in children. Children can still get infected and become very sick. The rate of hospitalization for COVID-19 children for children younger than 5 soared during the Omicron peak in early 2022, 5 times higher than during the Delta wave of 2021, according to our CDC partners. Once the Western states review the FDA and CDC authorization and recommendations, the Pfizer and Moderna vaccines for youngest children could be available as early as June 20th through providers who are open on the Monday, Juneteenth federal and state holiday and who are prepared to offer vaccines. Parents who want to vaccinate their youngest children are advised to call their healthcare provider to check on vaccine availability first. I'd now like to introduce Dr. Dawn Nolt from Oregon Health and Science University to provide some remarks on why COVID vaccines are important for our youngest children and information for families who have children who may soon become eligible to be vaccinated. Dr. Nolt?
Thank you so much, Dr. Seilinger. My name is Dawn Nolt. I am a pediatric infectious disease specialist at Oregon Health and Science University, and I'm a physician at Dornbecker Children's Hospital. I wanted to start out by saying the pandemic has been really hard on parents of young children in Oregon. As a physician, I have to say that the impact of viruses on young children really has been downplayed. And parents of young children really realize the possibility of severe disease in their child. Severe disease can occur in children even if they don't have much of a medical history or underlying medical condition. And once they become infected, children, as we know, can have short and long-term effects and health problems. But there's no way that I or anyone else can detect how a child's going to react if they get infected with COVID and what their long-term effects are. Now, we know at masks, as Dr. Seilinger says, continue to be important as a protective tool, but young children can't really reap the full benefits of masking because our very young children in preschool and daycares are in close proximity. They do have to eat and they do have to nap. And we do try to make sure they don't wear a mask and have to take them off for that. And in particular, children under 2 years of age cannot safely mask. And so this group really cannot reap the benefits of masking. If they were infected with COVID, young children, even those with underlying health conditions, don't have the advantage of getting some medications like the adults. Dr. Seilinger talked about Paxlovid, and this particular oral treatment is not approved in young children. And so for those who get ill, particularly in an outpatient setting, they really don't have any options. So I have to say that many families with young children are living like it's March 2020. They are afraid to have their children go to school or daycare, or even to receive needed medical care because they don't want to run the risk of getting infected. And these families, I'm sure you all know, families of young children in Oregon are so eager to have vaccines to then protect their kids. So I get this question a lot, which is, why did it take so long to get vaccines into young children? Why are the youngest children often the ones that are studied last and authorized last? So with any new product, research usually starts with healthy adults. And this is to establish that the vaccine is safe and works in that group before it starts to expand to other more vulnerable groups. And usually children are the last of those groups. It doesn't mean the vaccine is flawed. There's just a few more complexities when it comes to children. I'm going to outline some of those. You know, we're trying to balance the right dose of the vaccine for protection with the dose with the least side effects. And it's a lot trickier to determine that, the right dose of vaccines for the littlest ones. So we have to actually study a lot of different doses called dose ranging. And this takes a lot more time because there's a lot more data that's generated. It's hard to recruit kids for studies. We know that parents have been so eager to contribute to science and to have their kids be involved in studies, but still, it's a lot easier to get thousands of adults over 50 years of age than to try to get that same number in an age band, let's just 6 months to 6 years. So it takes a lot longer to get the proper numbers. And as always, the focus of the FDA and the CDC during this pandemic has been vaccine safety. And they have been particularly interested in making sure a large number of kids are studied in order to detect rare events. So I do tell parents and my patients, you know, we wish the vaccine process was quicker for kids, but thankfully today we're here now and we have 2 vaccine products. And we talked about how parents really want these vaccines for kids, but in particular, we know that they're needed because they can provide very strong protection against hospitalization. And as Dr. Seidler had talked about, according to the CDC, children did not fare very well during the Omicron wave. There were a lot of hospitalizations, particularly for those under 5 years of age. And in our state of Oregon, those under 4 years of age have had the highest hospitalization rate since Omicron really surged. And that's likely because those kids under 4 years of age don't have the vaccine available. The vaccine can provide strong protection against death. And again, I want to make sure that we are not underplaying the impact of COVID-19 on kids, because nearly 500 kids have died in this country, including 8 in Oregon. And it's important to know, and it's really amazing in such a high income country as ourselves, that an infection, COVID-19, is now in the top 10 causes of death in children under 5. And that to me is just, it's just heartbreaking. We know that vaccines against COVID-19 really can protect the child, but also really protects the entire family unit. Research is showing and continues to show that children can and do spread COVID-19 to others, and those others can include family members who could get very seriously sick. And we know that for the families in Oregon, there's disruption in care and schooling of children and family life. And if there's any way we can reduce that daily burden from COVID for our families, that's what we want to do. And so we wish that people would vaccinate, and we know that vaccinating children remains the best option to protect our kids and our families. I'm just going to go a little bit into sort of the two products, so Pfizer and Moderna, who put out the 2 vaccines. And I want to sort of summarize in advance by saying they're equally effective. So we want families to choose the ones that are available. As I'm sure you all know, Pfizer is a 3-dose regimen. Moderna is a 2-dose regimen. We could understand that some families may prefer the Moderna 2-dose vaccine because it calls for 1 less dose, and it means fewer trips to the doctor's office and less time off work for those families. The antibody response between Pfizer and Moderna are really virtually the same, whether you're looking at Moderna's 2-dose or Pfizer's 3-dose. We do have to appreciate that Moderna reaches the same level of antibodies in half the time compared to Pfizer. So 6 weeks versus 13 weeks. Now, we have to also recognize that each dose of Moderna has a higher amount of the active ingredient, shall we say, the mRNA, and it packs a little more of a punch. And so Moderna, we know, is a hotter vaccine. It will produce probably more more side effects, mild ones, such as fever or injection site pain. So when parents and families and others look at these 2 vaccine choices, there are upsides and downsides, but we want to emphasize that both vaccines will significantly lower the child's risk of infection and severe symptoms and hospitalization. And we recommend that families get their child vaccinated with the first vaccine that's available. If there's any uncertainty, then the families should discuss it with their child's provider. So in conclusion, vaccines are important tools to prevent everyone, including very young children, from COVID-19. It prevents kids from getting very sick and spreading to others, both in the home, in the school, and at the daycare. And we need safe and effective vaccines, and we have them now. We have them to protect our youngest kids. And so I highly recommend, as a pediatrician, as an infectious disease doctor, and as a parent, that children get vaccinated as soon as they can against COVID-19. And sort of on the bigger picture, this is a huge moment for us as a nation and as a state. And I feel like we are turning a page in this pandemic by being able to offer strong protection previously available just a few parts of the population. We can now offer this protection to the youngest part of our population. Thank you. I'm going to turn this back to Dr. Seidlinger.
Thank you very much, Dr. Knoll. Because Monday is a holiday, it may take a few days for the vaccine to reach all providers. If the vaccine is recommended this weekend, allocations of doses will prioritize equity for underserved groups and ensure the vaccine gets to all parts of the state. Our field operations team is also working with partners to develop a list of children with disabilities who may need vaccinations in their homes so that we can reach all children. Parents will be able to get vaccines for their children through their pediatrician or other healthcare providers, through local public health authorities, federally qualified health centers, and through vaccination clinics and other community events. Finally, thank you again to our public health, education, pharmacy, and healthcare partners who continue to serve the people of Oregon. Thanks also to everyone who continues to protect themselves, their families, their coworkers, and neighbors. Being vaccinated and up to date with your vaccines remains your best shield against severe disease. By supporting each other, particularly those who remain at elevated risk, we will be able to navigate this latest chapter with the fewest possible disruptions to our lives. And with that, we can now take some questions, Erica.
Thank you, Dr. Seidlinger. Okay, our first question comes from Anthony Carter with KOBI TV News in Southern Oregon. Go ahead, Anthony.
Hey, Dr. Seidlinger. Just a quick question. One of my questions is just about, do you have an updated numbers on the case counts, specifically in Southern Oregon? I do believe Jackson was in high risk for, I believe, the last update. I don't know if you know the situation right now.
Thank you for that. We continue to see elevated case reports throughout the state, and levels have leveled off. We know that that's likely the tip of the iceberg, with the latest data out of New York City showing that they were picking up about 1 in 31 cases. 3 counties last week, including Jackson County, did rise to the level on the CDC's community levels to be at the high level. Jackson has moved down this week back to medium, but there's still quite a bit of COVID in Jackson County, Southern Oregon, and throughout the state. That wearing a mask in indoor public places, particularly if you're at higher risk because of underlying conditions, age, or you're a caregiver for someone who is still a good idea at this time.
Thank you, Anthony. Our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thanks for taking my question. Actually, I just kind of wanted to ask you to elaborate there. So, one, to what extent right now are cases undercounted? Like, if you were to, based on OHA estimates, what is the true count of cases? One, and the other question would be, what are OHA's recommendations on masking and other measures in counties with medium or high risk, counties in medium or high risk under the CDC levels?
Thank you. I think when we look at multiple measures of spread of disease right now, we can see that disease is probably at a high rate. Our percent positivity is around 12%, which is high. We are still seeing significant detections in wastewater that mirror previous detections during Omicron and Delta. While we don't have a definitive number of cases, different modeling estimates and data from other communities like New York City, we would estimate that for every reported case, there are likely 20 or 30 additional cases. So a very significant undercount. The good news is that hospitalizations have remained relatively steady at 300. While that's, very hard for the individuals and families who are being hospitalized right now and battling severe disease, they're at much lower levels than they were during Omicron, our first Omicron surge and the Delta surge. At this time, I think for anyone who is at higher risk for disease, older adult, has underlying conditions or cares for someone in one of those categories or lives with someone in one of those categories, or if you're unvaccinated, you're at high risk for disease and could potentially develop severe disease. So I would say in low, medium, or high risk counties, those individuals should consider masking. For individuals who live in communities at higher levels of spread, everyone should consider wearing masks in indoor public places because there's a significant risk of exposure in those settings. And we should all support each other's decisions, no matter where we live, that if someone chooses to wear a mask, we should support that decision. But certainly masks are very effective against preventing infection with the current versions of Omicron that are spreading. And universal masking, if everyone in a space is wearing masking, can cut that risk down even more. And that's why it's recommended in those communities with the highest levels of spread.
Just a really quick follow-up. I understand these are estimates, but how would you say the undercount now compares to the undercount during the first Omicron wave? And the reason I'm asking that is to figure out like how these two waves compare to each other in terms of infection volume.
Yeah. I think it's hard to know exactly comparing the Omicron surge with BA1 and now our current surge with BA2 and other subvariants. Likely, we have more of an undercount now as we've moved more towards at-home testing, which aren't reported into public health on a regular basis. and many more people simply not testing if they don't have symptoms or have mild symptoms. So our undercount is likely higher now than it was during the BA.1 Omicron surge, but exactly how much and the magnitude of that is difficult to state.
Thank you.
Thank you, Fedor. Our next question comes from Gary Warner with EO Media. Go ahead, Gary.
Yeah, hi. Thanks for taking my question. Next month, there's going to be the World Athletic Championships in Eugene. 2,000 athletes from 200 countries coming to Eugene to compete. The federal government has dropped the requirement for people who are traveling from out of the country to show a negative test before getting into the country. Do you know what, if any, actions are being taken, safeguards, testing, that sort of thing, because there's going to be this unusual group, large group in one place in Oregon?
Thank you for that question. I think when we have large gatherings of individuals, it really increases the chance for spread of a highly contagious disease like Omicron. And that would hold true whether these are international arrivals from out of state, or bringing folks together in state from various parts of the state. With high levels of COVID-19 right now in Oregon and in other states and across the world, there's going to be many opportunities for spread. Luckily, the World Athletic Champions are primarily held outdoors, with many events being held outdoors, which can lower the risk for transmission. But OHA is working with our academic and local public health partners to increase wastewater surveillance around the event to try and monitor levels of disease. And we encourage everyone who participates or is planning to attend these events to be up to date with their vaccines, as that will offer them the best protection against severe disease and death. And when they're participating in higher risk activities, such as indoor gatherings, that they consider wearing a mask as they're getting together with large numbers of folks, often strangers, from outside of their region, and it does offer the opportunity for spread.
But is there anything specific about with the organization or the state having a system that people would be tested, or if people show signs, how they would be dealt with, since they're from out of the country, they're not going to have their local physician, that sort of thing?
Yeah, I think we will continue to encourage individuals that if they are feeling sick and think they may have symptoms consistent with COVID, that they isolate and limit their contact with others. Access to testing will be through community testing sites. Home tests are quite readily available. And so individuals can test themselves and determine if they have COVID and stay home and isolate. But we'll continue to message with our local partners, with the event partners, that individuals are ill, should isolate and not have contact with others, and that encourage to message the idea of vaccinations and masks being our effective tools against preventing spread.
But just to clarify, this you're suggesting this to individuals. There's not any, systematic, I don't know, protocol in place for the games. It's anything special above what's being done in the general community?
I think for more details about what's being implemented with participants of the event, I would encourage you to contact the organizers. I'm not aware of any specific protocols they have in place around testing, but they may have additional protocols that I'm unaware of.
Thank you, Dr. Seidlinger.
Thank you, Gary. And I see that Anthony Carter has his hand up, but before we get to follow-up questions, we want to first hear from the St. Helens Chronicle. Go ahead.
Hi, so my question is, so we understand that the OHA uses transmission and case rates as well as hospital capacity to sort of determine what necessary steps to take in terms of issuing precautions. So if there is a metric, what would that metric be to determine hospital capacity? And how is that compared or contrasted with regular hospital capacity?
Thank you. I think in our regular updates from OHA, we report the number of reported cases into public health, monitor trends in that and percent positivity, as well as wastewater to get an idea of cases and spread across the state. We also monitor the number of people in the hospital who test positive for COVID-19 on a daily basis, and this is self-reported into OHA by our hospital partners. This gives us an idea of severe disease. The CDC, the Centers for Disease Control and Prevention, utilizes community levels, which look at case rates in a particular community that they define, as a county, and then look at the number of folks in the hospital with COVID-19 that serves a particular area. And they break counties down into low, medium, and high levels of community spread. We refer individuals, communities, organizations, schools back to these community levels to help in making decisions about enhancing protections at times when COVID-19 rates go up and are starting to impact on hospitalizations. That's why in counties that reach that high community level on the CDC, we would recommend that everyone wear masks in indoor public places. But at any community level, individuals at higher risk or those who care for individuals at higher risk should continue to wear masks to protect themselves and their loved ones. And so, hospital capacity is looked at as the number of individuals who are in the hospital who have COVID-19 and the hospital's ability to care for any patient who shows up, whether they have COVID-19, whether they've had a heart attack or been involved in a motor vehicle crash. Everyone deserves to have emergent care and to get the quality care in hospitals across Oregon. And right now, we're not at risk of overtopping our ability for hospitals to provide that care. That's not to say that hospitals and healthcare is not strained, as we are 2.5 years into this pandemic. My physician colleagues, our other provider colleagues, nurses, respiratory therapists, and everyone who works in a hospital or even in a clinic or an office is tired. The patient volumes have been huge. Staff are susceptible to COVID, even though we have vaccination requirements. And so there are people calling out sick. And summer is a traditional time for people to take vacations. So certainly hospitals, are strained right now, but their ability to provide care to everyone who shows up is not nearly strained at the level that it was during Omicron and Delta. So we'll continue to monitor that and make recommendations based on that.
Thank you for that question. Our next question comes from Lisa Balick with Coin 6 News. Go ahead, Lisa.
Good morning. Both of you are pediatricians. And I guess question from parents is that if they've waited this long to get the under 5 age child vaccinated, there are parents who say, look, I know you're trying to say, get it now, get it when you can. But the reality is with some of them, they'd rather have the child vaccinated before they go back to school in the fall when they're inside, especially if the children, summertime, the weather hopefully at some point will become summer, and the kids are outside for the most part. So as much as you say you should get it now, is there really a downside though for parents who say, look, I just want to wait until they get it at what they feel is a more appropriate time right before school begins again?
Thank you. I'll start and then turn it over to Dr. Knoll. I think the downside is by waiting, that increases the amount of time that children could be exposed and potentially infected. And while severe complications, being hospitalized, multi-inflammatory syndrome in children are rare than they are in adults, they still do happen. With 500 children dying from COVID-19, that's 500 families who continue to mourn the loss of a child. And that's a horrible position to be in when we have a vaccine that could prevent that in the future. In addition, this can prevent and minimize the likelihood of developing long-term complications that's often referred to as long COVID. So disease rates are fairly high right now in Oregon and the rest of the country. So having that protection on board as soon as possible will offer that protection, and will continue to offer some protection against severe disease in the fall. And as we study the long-term protection from these vaccines, there could be additional boosters in the future. But for now, we know that these shots are effective at preventing severe disease and death, and will have a decrease on transmission, show impacts on the body's ability to fight off the infection, and getting them on board as soon as possible is the most important. Dr. Knoll?
Oh, Dr. Seinlinger, that was beautifully said. What can I add? But I will. I just came off of service at 8 o'clock this morning working at Dornbecker. And there's a lot of unexpected things that happen to kids that land them in the hospital. And COVID shouldn't be one of them. So if there's any way that we can reduce the uncertainty of things happening to our children, regardless of the time of year or other events such as school, they should partake of that protection. And so we have these vaccines, and I would urge, as Dr. Seinler is doing, I would urge people to get their children vaccinated so they can remove one uncertainty from their child's life.
Thank you very much for those wonderful responses, Dr. Knoll and Dr. Seidlinger. Okay, if we have no other hands raised, we're going to go to our final question. This is a follow-up question from reporter Anthony Carter, again from KOBI TV. Go ahead, Anthony.
Thank you. I just had it's kind of an off-topic question. Do you happen to have an update on monkeypox in the state by any chance?
Thank you. Oregon has confirmed our first probable case of human Mpxv infection in an Oregon resident. This resident returned to Oregon and had likely exposure and was likely infected out of state. We are working with our local public health and healthcare partners to assure that this person gets the care that they need to recover, and that individuals who had prolonged close contact with this individual, particularly skin-to-skin contact, receive the appropriate follow-up that they need. One thing to remember about this virus is it's very different than the COVID-19 virus we've been talking about for the last 2.5 years. It is not easily transmitted from person to person and really does require prolonged close contact, up in skin-to-skin contact. So it's easy to identify those individuals upon talking to someone who's sick, who were around them when they were potentially sick. And the person can only spread the virus while they're sick, not in the period before they get sick. So this is a much easier disease for public health to contain using case investigation and contact tracing and appropriate follow-up with those individuals who had close contact. So right now, there's one case in Oregon pending confirmation from the CDC, which should happen over the next several days.
Thank you. And just as I said, that was our last question. Gary Warner had one more follow-up. This is our last question. Go ahead, Gary.
Yes, thank you very much. I was just wondering if you could go a little bit into detail, Dr. Seidlinger, about B4 and B5. There's a lot of information about those in the media and the impact on the East Coast and in Europe. Tell us again a little bit about where we're at on that in Oregon and whether or not you think those numbers will grow and whether this variant is showing any sort of different outcomes compared to the first two waves of Omicron.
Thank you. Our current surge of cases here in Oregon is due to Omicron subvariants linked to BA2. This includes BA2 and a separate mutation, a separate set of mutations called BA2.12.1. These are causing the bulk of infections, with BA2.12.1 increasing fairly rapidly week to week in the samples we test. In Oregon, we are starting to see an increase in samples of BA4. And BA4 and BA5 are a little bit ahead in many countries in Europe. They seem to be overtaking from either BA1 or BA2 in countries, depending on where they are in their infection. It appears that individuals who've recovered from infection with BA1 or BA2 may be susceptible to infection from BA4 and BA5, but our vaccines continue to offer protection against severe disease, needing to be hospitalized and preventing death in individuals who are infected with BA4 and BA5. They also appear to blunt the potential for developing long COVID. So vaccines will remain our greatest protection against BA4 and BA5 as they increase in Oregon. These could potentially lead to a leveling off of cases at a higher level in the coming weeks, or potentially as cases come down, could lead to another surge in cases later on in the summer. But we would not anticipate a tremendous impact on hospitalizations, with hospitalizations not expecting to increase to levels that we saw during Delta and our first Omicron peak.
Thank you.
And thank you, everyone. I think, as I stated in my opening remarks, as we move into our third summer battling COVID-19, we're all tired. Many of us are looking forward to vacations, celebrations with friends and families, getting together outdoors and enjoying the weather, and doing the things that we did before COVID-19 started dominating our lives. As we do that, we have to realize that many of our fellow neighbors are still battling COVID-19. We see high levels of infection, and while most people have no or mild symptoms, many people have more severe symptoms. They're missing work for 5 or more days, missing school for that period of time. And unfortunately, we have about 300 individuals in the hospital right now battling COVID-19 and see deaths attributed to COVID-19 every day. So for those individuals, families, friends, and loved ones who are battling COVID or helping to care for someone who's battling COVID or mourning the loss of a loved one, my thoughts go out to you. We've been battling this disease for 2.5 years. Our tools have changed. The impact on our lives have changed, but it still has a tremendous impact on all of our lives. So by being up to date with your vaccines, wearing a mask in crowded indoor public places if you're at risk for more severe disease or care for someone who is, are our best tools. We have those tools at our disposal. Oregonians have used them at very high levels and have minimized some of the great impacts of COVID-19 in Oregon compared to some of our other states. So thank you to all my fellow Oregonians for the actions you continue to take. And hopefully we can all go forward into the summer with lower levels of COVID, enjoy some of the things we put off, celebrate with our friends and family outdoors, hopefully fully vaccinated and up to date with our boosters, and lower our risk for getting severely ill as we move forward and enjoy the wonderful weather in the Oregon summer. Thank you.